So bago na naman pumuli ang ating topic, head sign and symptoms. So dizziness. Dizziness is common complaint, especially in the elderly, in whom it may often is the main presenting problem. Why we ask? So it is necessary to ask about dizziness, particularly with elderly patients, because dizziness may be a symptom of liver wind or phlegm, both of which are pathogenic factors seen in wind stroke, to which elderly people are prone. In women, dizziness is often a key symptom to establish the presence of either liver blood deficiency or kidney deficiency. When we ask about dizziness in the course of the interrogation to confirm or exclude the presence of liver blood deficiency, kidney deficiency, or liver young rising, or phlegm in young and middle-aged people, or of liver wind in the elderly. How we ask? When we ask about dizziness, we should make it clear to the patient that even if the symptoms very sporadic, it still has a clinical significance. Thus, we should ask something like, do you ever experience any dizziness, even occasionally? Dizziness can be due to 4 factors, which we can be summarized as wind, yang, phlegm, and deficiency. In general, a sudden onset of dizziness indicates a full condition, and gradual onset indicates a deficiency condition. So, paano? The dizziness from wind is very severe, and the patient feels as if the ground is moving to the point where he or she loses balance. So, this is liver wind and is usually seen only in the elderly. Pag tinanong po natin, nahihilo po ba kayo? Oo, umiikot sa binyang paligid. Yun. So, wind po yan. The dizziness from liver young rising also may be severe, but less severe than that from wind, and is accompanied by headache and blurred vision. This is common in patients of all ages. So yung pag-liver yung rising naman yun. The dizziness from phlegm is less severe than both liver wind and liver yang, and is accompanied by feeling of heaviness and wooziness of the head and nausea. So ang pagkakaiba po ang may phlegm na mabigat naman yung pakiramdam, nahihilo sila pero mabigat ang pakiramdam. So may phlegm. The dizziness from deficiency of qi and blood is mild. It is worsened when the person is tired. Kasi nga deficient sila, kaya kung pagod sila, lalong silang nahihilo. And it is also maybe only postural. So dizziness from deficiency condition may be due to blood deficiency of the liver and heart, in which case it is accompanied by blurred vision. So alam natin pag kulang sa dugo, ang affected ay yung liver and heart at meron silang blurred vision. Meron din silang poor memory at may insomnia. Or to the kidney deficiency, in which case it is accompanied by tinnitus. Yung may naririnig silang ugong. Of course, dizziness also may occur as a result of head trauma. So natandaan po natin yung tinnitus, dalawang sound po yun, yung maugong at saka yung matining. So pag matining ay kidney. So dizziness, internal wind. Ito po yung ating summary. Severe vertigo. Pag ang dizziness ay may liver yang rising, so a dizziness with headache. Phlegm, dizziness, and wooziness worse lying down. Blood deficiency, mild dizziness lang po ito, better lying down. Pag kidney deficiency po, may chronic mild dizziness. Pag may head trauma, dizziness after accident. So, may cases still po tayo. A 40-year-old woman have been suffering from severe vertigo attacks for 20 years. She suffered severe attack with vomiting every 6 months. but she also experienced less severe attacks in between. The attack occurred usually in the morning and were aggravated by lying down and alleviated by sitting up. The attack became more frequent after the birth of her second child 2.5 years previously. She walked rather slowly, her complexion was dull and sallow, her eyes lacked sparkle, and she generally looked very depressed. She had very few other symptoms. She felt cold in general, experienced chilblains in winter, suffered from catarrh, and experienced backache. Her tongue was relatively normal apart from the side being too red. Her pulse was weak in general, especially on the left side. And both kidney position were very weak and deep. So diagnosis in this patient, vertigo is caused by a combination of liver yang rising and phlegm. So kaya siya nahihilo. Apart from the dizziness, so tumataas din yung kanyang liver yang. Evidence doon ay yung red side of the tongue and phlegm by the catarrh, the vomiting, the aggravation lying down, and the amelioration sitting up. Phlegm is causing the more frequent severe attack of dizziness, and liver yang rising is causing the occasional severe attack. Apart from these two patterns, there is kidney yang deficiency and spleen deficiency. So yung kidney yang deficiency po ay manifested dahil sa very weak and deep pulse or both rear position. So the aggravation of the dizziness after childbirth, yung backache and cold feelings. The spleen deficiency ay nagmamanifest po sa kanyang generally weak pulse and sallow complexion. Both its spleen and kidney yang deficiency are obviously the root cause for the formation of phlegm, and the kidney deficiency is the cause of liver yang rising. Yan. So sa kanilang from the mother and son relationship. Therefore, spleen and kidney yang deficiency are the root. So siya si Ben. While liver yang rising and phlegm are the manifestation. So nagmula sa spleen and kidney. The dizziness from a full condition is always more severe than that from empty condition. So pag empty po, pag liver blood deficiency, mild lang po yung dizziness pero meron siyang blurred vision at floaters. Ito po yung mga tao na sabi niya, bakit may nakikita akong parang tuldok na puti? Siya po yun yung floaters. Numbness or tingling of limbs. Yan, namamanhid yung kanilang mga limbs. Then, ang mens po niyan ay kukunti kasi liver blood deficient nga. Then, dull pale complexion. May pale tang po yan. Then, choppy or fine pulse. So, ang pwede po natin tusukan ay ang liver 8. Yan. Stomach 36, spleen 6, and ren 4. Pag kidney deficiency naman, so yung dizziness po mas malala pag gumalaw sila after exertion. Then, feeling of emptiness of the head. Parang sabi, hanggang ng ulo ko. Then, yan yung nakakarinig ng yung tunog na ting, tinnitus. Then, may backache po yan dahil nga andun yung ng kidney. Madaling mapagod, mahina ang mga tuhod. Other symptoms po niyan, ang sign depend on whether there is a kidney yin or kidney yang deficiency. So, acupuncture po natin ang kidney 3. Yun, third point. Oh. Then, ren 4, bladder 23, baka siya ng kidney, spleen 6. Full. Pag liver yang rising naman, ang dizziness po ay with headache. Then may dizziness, tinnitus, irritability, Yan, makikita ninyo, pag involved ang liver, irritable. Propensity to outburst of anger, madali siyang magalit, then wiry falls. So, acupuncture po natin liver 3, triple burner 5, and gallbladder 20. Pag ang dizziness ay due to liver wind, so severe dizziness. Yan po yung may vertigo, tremors, tinnitus, headache, numbness of limbs, tics, stiff, deviated, or moving tongue, wiry pulse. This is the most severe type of dizziness. Lagi lang po natin tandaan pag may wind, may mga movements lahat kasi yung wind gumagalaw. Ayan yung mga dila na nag-quiver, nakatagilid, mga muscle na gumagalaw. Siya po yan yung may wind. So, acupuncture po natin ay liver 3, gallbladder 20, do 16, small intestine 3, bladder 62, and do 19. Pag ang dizziness naman ay due to phlegm obstructing the head, so feeling of heaviness. So may phlegm, may heaviness, and wooziness of the head. A feeling of oppression of the chest, dizziness, blurred vision, somnolence, nausea, sputum in the throat, wooziness of the head, swollen tongue with sticky coating, slippery pulse. So, dahil phlegm po yan, siyempre special points for the phlegm, stomach 40. Rent 12, rent 5, bladder 22, and do 20. Pag ang dizziness naman po ay due to liver fire, so meron po siyang headache. Siyempre makikita natin ang red face. So dizziness, tinnitus. Yan yung pagkakaibang tunog naman ng tinnitus na due to liver fire. Ito yung maugong. Makakarinig kang yun. So, irritability, propensity to outburst of anger, thirst, bitter taste, may constipation po yan, dark urine, red po yung tongue with redder sides, and dry yellow coating. Then, wiry rapid pulse. So, madali natin malaman kung nasa liver yung ano problem. Kasi pag magagalitin, liver po involved. Chi and blood deficiency of the spleen and heart. So, mild po ang postural dizziness. Meron pong palpitation, insomnia, siya yan yung mga hindi nakakatulog, lagi nananaginip. At makakalimutin. Halimbawa, yung salamin, nasa ulo, hinahanap pa rin niya. Anxiety, then propensity to startle. Dull, pale complexion. Ang lips po niyan ay pale, madali siyang mapagod. Weak po yung muscle. Then, meron siyang loose stool. Or din po yung appetite, scant ang period, pale and thin tongue. Yung pulse po niya ay choppy or fine. Pag ang dizziness naman ay due to stomach and spleen deficiency, so mild dizziness. Dahil involved ang spleen and stomach, mayroong poor appetite. Slight abdominal distension after eating. Tiredness, lassitude, pale complexion po yan, weakness of the limbs. Yan for ano natin, for sides. Loose stool, uncomfortable feelings in the epigastrium, lack of taste sensation, pale tongue, and empty pulse po. So clinical note po natin in women, liver blood deficiency is the most common cause of dizziness. A kidney deficiency is also common. So in the elderly, look for phlegm as a cause of dizziness. When it's clearly due to emotional problems, dizziness is often due to liver yang rising.